Zipursky, joining us from Ohio. He is Chief Executive Officer of Disaster Avoidance Experts and going to be talking with us about impact, things of concern to us in the workplace, looking at COVID-19 through a slightly different lens. So thank you very much for joining us, and we welcome you.
Thank you very much for inviting me. I really appreciate it. And let's talk a little bit about how to look at COVID-19 effectively. How can you adapt and plan for it using neuroscience techniques as HR professionals? So let's talk a little bit about that. As was mentioned, I'm the CEO of Disaster Avoidance Experts, but my expertise is in cognitive neuroscience and behavioral economics. So I'm a cognitive neuroscientist. I've spent over 15 years researching cognitive neuroscience and behavioral economics in academia, specifically about decision-making. So that's what I want to look at, decision-making, how we make decisions around COVID-19, including some of the bad decisions that a number of folks made, folks who you might know, people like Elon Musk. So you've probably heard of Elon Musk. He's probably the loudest of the new breed of entrepreneurs, has a great deal of money, many, many billions of dollars, founder of SpaceX and Tesla. And on March 6th, he tweeted that the coronavirus panic is dumb. This was as the coronavirus was, of course, taking root here in the US. And of course, he's very popular, so that had a lot of likes, 1.75 million likes. Then a couple of weeks later, already after the declaration of COVID-19 as a major national emergency here in the US, he tweeted that based on current trends, probably close to 0 new cases in the US by the end of April. Well, as we know, we have way over 1 million cases here in the US and over 165,000 people dead. Terrible numbers. And he was very, very, very wrong. So that's very unfortunate, but a lot of people listen to him. He's very influential. A lot of people, including, if I'm sure some of the leaders in your companies might well have listened to him, because he's someone who gets followed a lot and people listen to what he has to say. They trust his expertise and his leadership, especially people who are more new money, who are more looking at the future. But he wasn't the only one wrong. Let's talk about old money. So Goldman Sachs, doesn't get more old money than that. Their expertise in providing financial advice to their clients. And one of the things they do is in providing fundamental financial advice is estimates of US GDP growth, because it determines the stock market, it determines investments, and so on. So February 24th, as COVID-19 was beginning in the US, but it's already pretty bad in Italy, they estimated that the US would have GDP growth of 2.7% plus positive growth in the second quarter. Now, just a few days later, March 15th, so about 3 weeks, they said that there would be a change. Their initial estimate was mistaken. Now it's a 5% decline. Oh my gosh, that's a terrible, terrible mistake. That's 7.7% off. Huge, huge, huge mistake. Really bad for their clients, obviously. But what happened just a couple of days later, March 20th, they issued another estimate. And now they said it's going to be a 24% decline. So 24% decline, change of 5 days from 5% decline to 24% decline. Obviously, they screwed up. And the final numbers that came out recently, we know that the actual US GDP growth in the second quarter was a decline of 32.9%. So even their worst estimate was badly off. So we have both very prominent new money figures like Elon Musk and very prominent old money figures like Goldman Sachs and many more giving bad predictions of COVID-19, making mistakes, and very many people following them. As a result, very many companies were unprepared. So at this point, I want you to take a look at this app here at the bottom of the screen, what you see, vbox.app/m#/102065983. And I want you to go to that in your email. So in your browser. Here is going to be the actual, so if you look in the chat window, you should be able to see that. And what I'd like to do is have a poll, and so that you can engage, give feedback on what's going on in the presentation, in your companies, and your perspective on the matter. So please go to that. I'll give you 30 seconds to go there, and then we'll start doing polls. All right, so please go there, 30 seconds. April says that hers is taking a little bit to load. Okay, I'll give another 30 seconds so that folks have time to load. So please make sure that it loads. You should be able to see the meeting, the title of the meeting, and what we'll be doing. All right, so take a look at the poll. Oh, there's some additional answers, but anyway, you should be able to vote on we seriously overestimated the impact, we moderately overestimated the impact, we got it spot on, we moderately underestimated its impact, and we seriously underestimated its impact. So please go ahead and vote. Thomas, sorry to hear it was locked in by your IT staff, but it happens. You can actually go on your phone. So if you have a phone, if you have your smartphone, you can use that. Don't think they blocked it. So I'll give people 5 more seconds to vote. And Thomas, you can go to your phone. In the meantime, we'll have a number of polls throughout the presentation. All right, so closing the poll. So now you should be able to see the results on that same link. And you'll see that of the people who are present, most either moderately or seriously underestimated its impact. So 20% underestimated its, overestimated its impact, 20% got it spot on, but 60% either moderately or seriously underestimated its impact, which is characteristic of the large majority of companies who followed the advice and other organizations who followed the lead of Goldman Sachs and so on, Elon Musk and so on. So let's take a look a little bit about why they were unprepared. They were caught unprepared. They really had a lot of problems dealing with it, and they turned to their emergency business continuity plans, which of course, as HR leaders, many of you helped put together these business continuity plans, risk contingency plans, and this is something I do pretty often for companies. I'm a disaster avoidance expert. They bring me in to create their business continuity plans. And I can tell you that they're not a good fit for the pandemic. This is not a good role for the business continuity plans. They're not what the situation calls for, because those plans are great for emergencies. You know, when there's a hurricane, that's great for what this is about. Of course, it doesn't happen much in Illinois or Ohio, where I'm from, but let's say there's a blizzard. So blizzard is a great example of something that a business continuity plan is great for. And there's kind of a 1 to 2 week interruption, maybe a major flood, something like that. 1 to 2 week interruption in your business. That's great. That's a great example. But COVID-19 is not that. It's not an emergency. It's not an emergency that we typically think of it. That's not what business continuity plans are for. It's a major disruptor. It's a slow-moving, high-impact, long-term event rather than a one-time brief major occurrence. So this is not a good fit for business continuity plans. Yet so many businesses and organizations, other organizations, nonprofits, municipalities, relied on their business continuity plans. And that's not great, because you get burned out relying on your business continuity plans, which are meant for an emergency. This is not a sprint. That's what a business continuity plan is for. It's a sprint. COVID-19 is a marathon, and relying on business continuity plans leads to serious problems. I've seen that very many companies resulting in serious problems when they relied on their business continuity plans. Now, we need to understand that vaccine is the only solution to COVID-19. That's the only realistic solution. It's the only thing that we can actually use to resolve the problem. And human trials to take a vaccine, and this is going to lead into, I'm leading into this because we want to talk about what it means for it to be a long-term major disruptor. So vaccine is the only solution to it. Human trials, which a number of vaccines are in various stages of human trials right now, including the last stage, phase 3, a couple of vaccines, Moderna and Pfizer are starting phase 3 trials. By the way, don't believe the hype about the Russian vaccine. I can guarantee to you that they have not done good studies on it, and it will not be a good vaccine, so do not trust that. So human trials, actual good trials to test their safety and effectiveness, take at least 1 year. So they take at least 1 year to estimate the safety and effectiveness going from phase 1 to phase 3 after the vaccine is invented. So you keep hearing in the news, we have a new vaccine invented. Well, it doesn't matter if you have a vaccine, I mean, it matters, but then you need to go through trials to test whether it's safe and effective. So if you throw all the money at it, which we are, and if you cut all the red tape, which we are, it's going to take at least a year, as opposed to the usual 4 to 5 years. That's what it usually takes with the regular process. So we need to understand that regardless of that regular process, regardless of the year-long timeline for typical trials, historically it has been the case that the first wave of vaccines doesn't make it through human trials. Most vaccines that are created don't make it through human trials. We have only 2 vaccines in last stage trials right now, the Moderna vaccine and the Pfizer vaccine. And given that most vaccines don't make it through human trials, it's unlikely that these 2 will make it through human trials. Just speaking from past experience, you can hope for the best, but you can't plan for it. You need to plan for the worst, right? That's the wise approach to planning. So it's likely that the first trials won't succeed. And this is not the end. It's like when people talk about, hey, we should start getting initial results on vaccine trials by the end of 2020, and we should get the final results by the spring of 2021. That's kind of what Anthony Fauci and so many people are saying that that's kind of where we get the initial results. And even if it's wonderful news, even if the vaccine proves 90% effective, which is incredibly unlikely, unfortunately, probabilistically speaking, but let's say it does, what needs to happen next? Well, the government would need to work with the corporation that produced the vaccine to produce enough of it for all Americans, or at least most Americans, then distribute it widely to all Americans, most Americans, and then actually vaccinate people and get people to take the vaccine. And the last step is surprisingly hard. We know that from polls, only 50% of the people are ready right now, willing to take a vaccine. 30% or so aren't sure, 20% are categorically opposed. So we have to have a major public education campaign to at least get a 30% to take the vaccine. So how long will that take to do this? This is a very complex long-term process. It's not a simple, here's magic, we have a vaccine magically approved, not magically approved, we have a vaccine approved. Let's say the Moderna vaccine works. That would be wonderful. We would know and get final approval of whether, if it does indeed work at very high effectiveness and safety, which again, very unlikely, we would know that starting to know that by the end of this year, with final confirmation coming in something like March or April of next year. Then how long would it take to produce distributed enough vaccine? Well, so far, the government has unfortunately not shown a high level of competence in coordinating and addressing COVID-19. Federal government, of course, would have to take on the role of vaccine management and distribution. So that's the role, of course, the role of federal government, which it indicates that it will. Presidential administration has indicated, yes, we'll all in on the vaccine. But so far, it has not shown a high level of competence in addressing testing lags and problems. We still don't have nearly enough tests for the population that we need to open up the country in a safe manner, or go to schools in a safe manner. Personal protective equipment, masks, and so on we don't have nearly enough of that, and the federal government is not doing a nearly good enough job to address that. And so many other issues around COVID-19, let's say contact tracing. There's no national registry of contact tracing, no national effort to do that. So there's a lot of problems with the government. I would not trust it to do a highly competent job with vaccine. So this is something we have to understand. This production, distribution, vaccination will take a lot of time, and much more than we might think it will with the government capacity that we have. So let's talk about possible timelines of when this major disruptor would be addressed. We have an optimistic timeline, a moderate timeline, and a pessimistic timeline. We have to be pessimistic. We have to have that scenario as well. Optimistic timeline. This is the great news. This would be wonderful. It would be terrific. It would be, in all the possible realistic worlds, unless somebody is able to snap their finger and have have COVID-19 indeed magically disappear, this is the realistic optimistic scenario, the best thing that we can really hope for. It'll be approved by mass production by summer of 2021. So sometime like the spring or summer of 2021, it will be approved for mass production. Then the production, distribution, vaccination of it at a very high level of government competence, much, much higher than the government has shown before, would only take 6 months. So we'll have most people vaccinated by early 2022. So end of 2021, early 2022, that would be when when we can really say we've dealt with a major disruptor of COVID-19. It's very optimistic. It's very unlikely. I'd say there's only a 25% chance scenario given all of these conditions and difficulties. Then the moderate scenario. This is something that's much more likely to happen. This is the more of the reality that we live in. This is not the best case scenario, but far from worst. It'll be approved for mass production. So we are assuming that the Moderna and the Pfizer vaccine don't work out. They're either not sufficiently safe or not sufficiently effective or both. And some of the other first wave of vaccines don't work out either. So we will only get a sufficiently safe and effective vaccine sometime by 2022, 23, 24, with 23 as a midpoint. So that's when we'll get approval of a safe and effective vaccine that's at least 80% effective. So we didn't have, if you have a vaccine that's, we'll talk about that. So you have a vaccine that's 80% effective, ideally 90% effective and approved and safe. Then at a moderate level of government competence, higher than the government has shown so far, but not nearly as high as the most optimistic scenario, most wonderful situation possible. It'll take a year to produce, distribute, and vaccinate people. And that has to mean that the government has shown more competence, certainly more competence than it has shown so far, the federal government. And so we'll have most people vaccinated by 2024. That is the moderate scenario. So the moderate scenario, instead of 2022, it will be sometime by 23, 24, 25. So the midpoint is 24. So 23 to 25. And that range from 23 to 25 is going to be 50%. This is the most likely thing to happen, where we'll have a safe and effective vaccine, widely vaccinating, with the population widely vaccinated with a safe and effective vaccine, most people, the large majority, enough to get herd immunity. We need to have something like 80% of the people have immunity to COVID-19 to have herd immunity. You've probably heard of these numbers. 70 to 80%, different people have different estimates, but that's when we can have, say, herd immunity by 2024 is going to be a 50% scenario with a range of 23 to 25. But that might not be the world we live in. We have to, while again, hoping for the best, or at least moderate, realistic, we can also need to plan and address the worst case scenario, pessimistic. We'll have a vaccine that's safe and effective, approved for mass production by 2026. So not in that moderate range. So it'll be somewhere by 26, 27, 28. And then production, distribution, vaccination. Well, this is a pessimistic timeline. So assume still a moderate level of government competence, not terrible, not the kind of lack of competence shown so far. It'll take a year. Then we'll have most people vaccinated by 2027. So that will be when we really have dealt with COVID-19. Now, you might think that this is too cynical, but this, I'm going to give this a 25% scenario because we still don't have an effective vaccine for the flu. We have been working trying to deal with the flu for over a century, and our only vaccine is something like 50% effective. 50% effective, and Anthony Fauci is talking about how, we might not have a vaccine that's effective, more than 50% effective for COVID-19. And of course, the FDA, he said, will approve that vaccine because 50% is better than nothing, which I certainly agree it's better than nothing, but that would not take us into a world where we have herd immunity and where we've truly dealt with COVID-19. Think about a world for your corporation, for your organization, if you only have a decrease in 50% of the likelihood of COVID-19 impacting your workplace. That will not deal with the situation thoroughly. It will certainly make a difference, but there's still going to be a number of outbreaks, a number of problems, and that's going to be a serious issue. So that could still be the case. Now, that is the reality in which we live. And that is something that we need to address. I want to encourage you to not plan for the optimistic scenario. So this is something that a lot of companies are doing right now. They're planning for the optimistic scenario. I mean, some companies are being unrealistically optimistic, meaning that they're thinking that it'll be over by the end of this year. I do have observed companies with that mindset, with some leaders with that mindset. But even leaders with a more realistic mindset are still, very many of them are planning for the optimistic scenario. They're thinking that it'll be over, by the end of 2021 at the latest. But there's a really good phrase attributed to famous football coach Vince Lombardi that hope is not a strategy. That is not a good approach. So I want to encourage you to prepare for the moderate or pessimistic scenario. Ideally, if you have the resources, you want to prepare for the pessimistic scenario, but at least the moderate scenario. All right, so let's take a look at the polls now. I hope more of you have been able to access the polls. And I want to ask you to vote on which of the vaccine scenarios will you plan for going forward. So again, type in the chat for the poll if folks haven't seen it in the chat. I think there's somebody who joined us recently. Okay, so I see most people have voted. I'll give folks 5 more seconds to vote. All right, so we see that 25% of the people, still despite what I'm suggesting, will plan for the optimistic scenario, but most people, 75% of you, will plan for the moderate scenario. And that's definitely a wise strategy. You're not quite planning for the worst case, which, if you have the resources, I strongly encourage that, but at least you're planning for the moderate case, which is the most realistic case. So if you address the moderate case, then you will encompass the 75% of probability of either optimistic or moderate. Then you won't address the 25% probability of pessimistic, but at least you will address the large majority, 3/4 of all scenarios you will address if you plan for the moderate scenario. So let's talk a little bit about decision making. This is not easy to hear. First of all, I just want to be very clear about that. It wasn't easy for me to learn about when I started learning about this. As a disaster avoidance expert, I started researching this once I started finding out about Wuhan, China, this COVID-19, and I started seeing that it's a very serious situation. And I really struggled learning about this. People dismissed COVID-19, Wuhan, as just an item in the news, but that's not a wise idea to dismiss it. I was writing op-eds already in early March. There was an op-ed in the Columbus Dispatch, for example, and an interview with 10 TV here in Columbus, Ohio, where I live, that I said that people would dismiss it and they would make really bad decisions around COVID-19. They don't anticipate how bad it will get and what we will really have to do to deal with COVID-19. So that's why a publisher approached me and said, hey, would you like to write a book about this topic? So very quickly, I wrote a book called Resilience, Adapt and Plan for the New Abnormal of the COVID-19 Coronavirus Pandemic, which is out right now. And this is what the presentation is based on. So because the publisher saw that I wrote those op-eds and was interested in my perspective on it. I struggled. It was really painful. It was really difficult because Wuhan is a huge city. It's a huge metropolis, 11 million people, over 22 billion in revenue. It has something like 200 international flights per day. So if you assume around 500 people on those double-decker flights to China, that's around 10,000 people going in and out of Wuhan. And of course, it would spread elsewhere. Of course, it's inevitable that COVID-19 would spread out of Wuhan widely. And there's a reason that it hit northern Italy first. I mean, of course, outside of Asia, it spread in Asia, but in Europe and in the US, all of these parts of the world, it hit northern Italy first because northern Italy has the closest ties to Wuhan. It has ties to its clothing industry. So very close ties, and that's why northern Italy got the brunt of it in the developing world, in the developed world. My clients really also find it difficult to accept when I talk about the moderate, optimistic, pessimistic scenario. it's not something they want to hear. It's very uncomfortable because our emotions, our intuitions, our gut reactions are to reject such painful information. Our intuitions, our gut reactions are our heart, what we feel, does not want to accept such painful information. But how to get over this? Our emotions just dominate our decision making, just to be honest. If you look at the cognitive neuroscience of this, about 80% of our decision making, 80 to 90%, is driven by how we feel, not what we think. When we just go forward and we do what comes naturally, intuitively to us. What we need to do is learn better habits of decision making, and learn one of the ways to understand it and accept it is to realize that we'll have much more pain in the long term if we don't accept this painful information and really not prepare for the optimistic scenario. I want to encourage those 25% of you who voted for that. You want to accept and adapt to this major disruption rather than hoping for the best and instead of planning for the worst. So this is what we're dealing with, our future until widespread vaccination. This is what I talk about in my interviews and op-eds early onward in the pandemic. We're going to face loosening of restrictions and an increase in cases. You've seen this in a number of states in May and June of this year, and a lot of still going on right now, July and August, where there's a number of states that were opening up a little bit faster than they should have. Florida, Texas, Arizona, and Louisiana, and then they had an increase in cases after these loosening restrictions. And then, of course, because the situation was getting very bad and hospitals were getting overfull, they had tightened restrictions. And they see a decrease in cases, naturally speaking. And this is what we'll be facing. This is our future until the vaccine. We'll have repeating cycles, repeating waves of looser restrictions, increase in cases, tighter restrictions, decrease in cases. So a lot of businesses that have opened up in these loosened restrictions have now had to shut down again because of these tighter restrictions. And this is going to be something that keeps happening and happening and happening. And this is fortunately, my clients are not facing this because I told them from the beginning, don't open up. It's cost so much money, cost so much effort to open up, and there's some legal liabilities, of course. Talked about the presentation early on with COVID-19. There's some legal liabilities with opening up. Well, this is not a good idea. You don't want to open up in this situation where, realistically speaking, in a couple of months, you'll have to close back down again. But so many people did it who are not my clients, who aren't kind of listening to this and not listening to me about this topic. We'll have to have various levels of social distancing and shutdowns until the vaccine becomes widely available. This is a fundamental principle that you want to integrate into your own work and bring back to your company. The world will change forever. This is something we have to realize. We're never going to go back to January 2020. Because even in the most optimistic case, it'll be over by early 2022. These waves of restrictions and loosenings and restrictions and loosenings will change people's habits, norms, values, fears, anxieties, emotions, behaviors. We'll never go back to that time. And this will not be a time that we go back to, but it's very hard for us to accept that. Your role as a trusted advisor, you are as an HR personnel, are trusted advisors to the leadership. So your role is to empower your C-suite, your executive leadership, to realize the full extent of this major disruption. Most are way too optimistic about this. They're preparing for either a realistic optimistic, or too many are preparing for unrealistic optimistic scenarios. You need to instead help them accept the uncomfortable reality that we are actually dealing with. By doing that, you'll help them accomplish their leadership goals. So they'll be grateful to you, and of course, the company, the business, the organization, if you don't serve in a company, will be better off. And it will build trust in you as a trusted advisor. So it will help you guide them going forward. It will build up your relationship and credibility in their eyes. Now, the pandemic, so talking about decision-making now, so talked about that. Talking about decision-making, the pandemic is a slow-moving threat. And we as human beings, unfortunately, make very bad decisions about such threats. And this is my area of expertise. How do we make decisions, especially in response to threats? Threats that are unusual, slow-moving, we make very bad decisions because of how our brain is wired. So here's the cognitive neuroscience. This cognitive neuroscience is the study of how our brain is wired, the structure of our brain, and how we behave, function as a result. And my other area of expertise is behavioral economics. How do we function in economic situations? So our brain is not wired to make good decisions about slow, unusual, slow-moving threats, unusual, high-impact threats. We underestimate their impact, and this leads to decisions that endanger our businesses and other organizations. But unfortunately, the bad advice of going with your gut, trusting your heart, going with your intuition, instead of actually looking at the data and evaluating its long-term consequences, which is what we're doing here, is way too common. People say, well, go with your heart, trust your gut. This is what I feel, and therefore I will do this. Well, then they fall into dangerous judgment errors called cognitive biases. So cognitive biases is what I actually study and what I researched, and so this is my area of expertise. I actually researched how to address cognitive biases, how to deal with them, how to solve these problems. So you've probably heard of cognitive biases as the specific errors that we make that come from a combination of our evolutionary background and the structure of our brain. You've probably heard of the fight or flight response to threats. This is something that is way too common to us as human beings. The fight or flight response to threats is something that is ingrained in us. It's part of our instinct. It's part of going with your gut. It's our heart, it's our reaction, it's our heart, whatever you call it. That is what going with our gut is like. This is something that is very important for us to understand. And this fight or flight response really does not serve us well in the modern environment, but it's not for the modern environment because our evolutionary background, what we're wired for, our instincts, is for an environment of hunter-gatherers, tribal environment, when we lived in small tribes of 15 people to 150 people. And the kind of threats we faced were intense, immediate, in-the-moment threats, like saber-toothed tigers. You might have heard of this as a saber-toothed tiger response, where we jump at 100 shadows to get away from that one saber-toothed tiger. Well, guess what? That's a bad response in the modern world, because the risks we face are much more long-term, uncertain. They might come from a notification on your smartphone about somebody forwarding you an article about a disease in the middle of nowhere, China. Well, it turns out it's not in the middle of nowhere. It's a huge industrial metropolis that I mentioned. It's actually called the Chicago of China, by the way. You being where you are, you should realize kind of the consequence of that. It's kind of the heartland, major industrial city, major metropolis of local trade, so in the region, major domestic hub, and of course, international hub. Now, there are three dangerous judgment errors, cognitive biases, that I specifically want to highlight. The normalcy bias, the planning fallacy, and hyperbolic discounting. These are the worst cognitive biases for COVID-19. Normalcy bias. We tend to assume that everything will keep going normally. So think about yourself in the future, 5 years from now. Let's say, imagine yourself. What do you think you will be 5 years from now? Now, when people look at themselves, think about themselves 5 years from now, they imagine themselves to be, I imagine myself to be mostly the same as I am right now. Hopefully slightly wiser, hopefully slightly richer, hopefully maybe a little bit more fit because I do more exercise, hopefully. But that is not necessarily what's going to be the case. Imagine yourself, look back at yourself 5 years ago. Think about the person you were back then, so 5 years ago. You'll probably realize that you were a very different person in a number of ways. You've changed in a number of fundamental ways over the last 5 years. Your values, your preferences, your situation, your context, you've changed. But we don't think that we will change in these same ways in 5 years from now. Why not? I mean, you'll have the same amount of time, and the pandemic, will be very impactful. So this is something that you're likely going to be just as different, even more perhaps different in 5 years as you were 5 years ago. But we don't think about that because we tend to assume, and the same goes up for our organizations, by the way. So when you make strategic plans and so on, people make very bad estimates about strategic planning. Talk about that later in the Q&A. In the Savannah environment, it was actually a safe assumption that everything will keep going normally, that the future would be much like the short-term past. That is what we tend to assume, because in the Savannah environment, things don't really change. It's going to be mainly change of seasons, where you are in different seasons as you're going hunting, foraging, and gathering. Winter, spring, summer, fall. That is not what our modern world is like, of course. Our modern world is much more complex. I mean, think of the technological disruptions. Let's say a smartphone. How much has it changed your life? Fundamentally changed our lives, being connected all the time and so on, carrying this thing in our pocket, camera, phone, and so on. And what about the fiscal crisis of 2008, 2009? That was a human-caused major disruptor that really damaged so much. And what about to COVID-19? That's a combination of a biology and human-caused disruptor that's changed so many things, so many dynamics. Of course, September 11th is another example of a human-caused one. But we underestimate both the likelihood and the impact of these major disruptors. We want things to go back to normal. This is why so many companies, so many organizations are rushing to get back to the office, to open things up, to go back to their previous existence, even when it's a bad idea. That's normalcy bias. Planning fallacy. We tend to assume that the future will go according to plan. We talked about planning. We make a plan, we think things will go according to plan. We've probably heard the phrase that failing to plan is planning to fail. That is what the phrase is about. Unfortunately, it's a very, very problematic and misleading phrase, because when we make a plan, we think that we won't fail, that things will go according to plan. In reality, a much more effective phrase that I teach my clients is failing to plan for problems is planning to fail. Again, failing to plan for problems is planning to fail, because we underestimate risks and threats and various sorts of issues that will derail our plans and the resources we need to address them. Time, money, information, social capital, strategic planning resources, all of these sorts of things. And finally, hyperbolic discounting. Hyperbolic discounting is a major problem. We perceive the short-term future as more important than the long-term. And that was a safe assumption in the Savannah environment, because we couldn't really invest our resources for the long term. You know, when our ancestors caught a mammoth, let's say, killed a mammoth, they needed to eat as much of it as possible in the moment, because otherwise the meat will rot. So they need to fill their bellies and not worry about tomorrow. They needed the resources right then and there. And we are the descendants of those who had a very strong fight or flight response and who could very quickly eat a lot of the mammoth meat that when we came across a source of these resources. But in the modern world, that's of course not relevant. Well, you have a fridge right now, but you're not going to be catching a mammoth. You'll likely be making money, which you can invest for the long term. You can invest in your organization for the long term. Organizational development, a major HR function, is investing in the long term. You're having good policies and so on. Investing in the long term, changing your culture to invest in the long term, and investing in your own professional development, in your career for the long term. But we don't tend to value the long term nearly as much as we should. We prioritize the short term to the harm of the long term. And this is why we underestimate the long-term impact and outcome of COVID-19, not thinking about it as the long term. About a week ago, I had an oil and gas company, a pretty major one, contact me about doing a strategic planning retreat for them. And I started talking to them about the strategic planning, and I asked them, well, what are you doing about COVID-19 as part of your strategic planning? And they said, well, we're just not really considering it as part of our strategic plan. We're dealing with it as a day-to-day issue. In the meantime, they have a lot of impact from COVID-19 on this day-to-day level. And they're not thinking about it, that it will still continue for at least 2 years, for at least, well, a year and a half. And that will be very optimistic, more realistically for the next 3, 4 years, 5 years. So they have not made it part of their plan, which of course, as part of the strategic planning retreat, I strongly encourage them to do. So that's the cognitive biases. And now I want you to take a look at the poll again and vote on which of these cognitive biases is most problematic for your organization. So for your organization in particular, which of these cognitive biases is going to be most dangerous? Please vote. Okay, I see most people voted. I'll give people 5 more seconds. Okay, great. So you'll see that the normalcy bias and hyperbolic discounting are tied for just over a third, are the most dangerous, and planning fallacies for a quarter, the most dangerous. So clearly all of these problems have serious impacts on your organization. For various people, various problems have more impact than others. All right. How can businesses and other organizations prepare? So we're going to the preparation stage. We talked about the problems, we talked about addressing it. You want to make fundamental changes to your business model, to your organizational model, for a future focused much more on virtual interactions than it has been in the past, much more. Like I said, a lot of people are falling into normalcy bias very badly, trying to go back to the office, but this is a terrible idea. I strongly encourage people to make a commitment to virtual teams and offerings much more than they're doing before. So it doesn't mean you shouldn't have anything in the office. Not what I'm saying, but you should really shrink your footprint and a lot of your office space lease. So this will give you a lot of money, free up a lot of money that you can invest into changing up your dynamics, your culture, your organizational model to shift to mostly virtual teams and offerings. So saving a lot of money, keeping yourself safe and protected, and planning for the long-term impact of COVID-19. Because the reopenings that are happening right now, I will be happy to put a lot of money, bet dollars to donuts that in the fall, unfortunately, you'll have a lot more closings than you have right now. So and a lot of schools won't open. This will be really bad. Virtual teams and offerings are the North Star. That's what you want to orient toward. But that means making a lot of changes. There are 6 areas that you want to change in your internal organizational model. Whether it's a business or a company, same thing. Internal controls. You want to ensure financial security. Of course, that's going to be really important. There's a lot more hacking going on right now through spear phishing, for example. This is just one of many examples where someone sends an email to one of the, let's say, one of your executive officers and gets their information, and then they can even they can impersonate their voice and have someone call the finance office and say, hey, I'm the CFO and I'm going to here, you need to make a payment to this address or something like that, or their style of writing. So a lot of this high level whale phishing, it's called spear phishing for everyone, but whale phishing for high level. And this is just one of many examples where that's going on right now, where executives are spending a lot more time at home, so they're not able to pop into, if they need some changes, they're not able to pop into the office. So you need to have, of course, some protocols to address that. And that leads into preventing various cybersecurity vulnerabilities. I had one of my clients where the CEO was an older gentleman, so he didn't know didn't have a very good home office setup. So what he did was when he had trouble accessing the virtual computer in the office, he turned off his firewall. Yikes. So not good, not good. There's no wonder that the FBI has reported a great deal more cyber hacking going on right now, especially in your higher level officers who tend to be less tech savvy because they're older, and they have secretaries who do that, executive assistants who do that for them. You want to adapt your existing compliance practices, whether ranging from cyberbullying to harassment to ADA to the new situation, and pursue compliance with CDC guidelines. I strongly encourage you to, as much as possible, go to virtual. Maybe keep 1 or 2 people in the office to receive checks, deal with mail and so on. And if you do have things in the office, if you do need to have a meeting, you can have a co-working space. So co-working spaces are really great places. But if you do have that in-person meeting, comply with CDC guidelines thoroughly. And you want to revise your internal measurements of effectiveness and efficiency. So effectiveness and efficiency are going to be different in the environment that we're in virtual teams. So you want to revise that. Now, moving on to an important measure of effectiveness and efficiencies is effective engagement, motivation engagement. Now, before the pandemic, only 34% of employees were fully engaged, which means they're creative, problem solving, really invested in the company, willing to sacrifice for it, according to Gallup surveys. So 34% of employees were fully engaged. Most people, around 60%, were disengaged, which means that they were just punching the clock, doing enough to get by and not get in trouble. And about 15-16% were actively hostile, where they were looking for a new position, bad-mouthing the company, willing to steal from it, for example. So that's what was the case before. Now, you're probably already finding to the same extent that people working from home have a lot more trouble with motivation engagement because we're tribal creatures. So it's very intuitive for us to connect with others and be motivated by them when we're close by, working close proximity. And that's not what we're doing at home. So this is a difficult thing. You need to support your employees, especially the stress of adjusting to life in the household in the pandemic, with kids not going to school and so on. So support and guidance. This is something that you as HR professionals need to provide to your employees as they're working from home. Then effective communication. It's notoriously difficult to do effective communication in the workplace, but it's especially difficult to do virtual communication when you're used to in-person communication, because you're switching mostly to text. You're using things like, I hope you're not using emails only, but things like Microsoft Teams, Slack, Asana, Trello, Mondays, various other software. It's text-based, mainly text-based. And you're losing a lot of nuance. You're losing body language. You're losing tone of voice. When I say something like, I think Michael should take that project, or I think Michael should take that project, those two sentences mean very different things. But when I write them down, they mean the same thing. This is a training issue. This is professional development. You need to train your employees in communicating effectively in virtual teams. Happy to talk about that in the Q&A. Then resolving conflicts, another area that's really important to address. Face-to-face interactions, it's natural to notice problems. When somebody has an anxious face, a surprised face, a worried face, it's natural to notice them and resolve them in the moment, because you can see each other, you can communicate effectively. In a virtual team, you often don't even notice the problems that are arising, and it's going to be difficult to communicate effectively to address them. So this is another issue of training, professional development. You as HR professionals need to provide professional development in how to resolve conflicts in the workplace through virtual settings. Cultivating trust. This is another area that's important, and we don't notice that it's important and that we do it naturally in office settings. You just build relationships naturally. Go to the break room, have some food, and chat about your kids. Local football team. What's going on with for your vacation plans. That's not something natural for virtual settings. That just doesn't happen. So you need to create a setting. This is not a matter of training. Those two other things, communication, professional development, or a matter of training. This is a matter of creating a specific virtual venue, which we can talk about in the Q&A. And accountability. So this is another venue issue. Office environments, there are very natural ways to hold employees accountable. So as a supervisor, you can walk around, check what other people are doing. As an HR professional, you can chat to people pretty easily and hold people accountable, make sure that they're in compliance with various practices. You can observe them. But you can't do that, of course, in virtual teams. So you need to create new structures to ensure and enable accountability and compliance, both up the chain of command, so as a supervisor or as an HR officer, and peer-to-peer accountability to each other to ensure everything from cyber bullying to sexual harassment in the context of virtual teams does not occur, and that people are accountable to each other and comply with appropriate guidelines. So that's the internal business model. That's something that you as HR professionals will spend more time on. But as trusted advisors, you also need to support your leaders in changing the external business model. And of course, to the extent that you do have a role as executive in the executive team, as business leadership positions, because of course, HR professionals do have an impact on the business itself, you want to help them change the external business model. And this is a matter of organizational development, OD. So it's something definitely a number of HR professionals are involved in. Service delivery. You want to transition your offerings to virtual or socially distanced as much as possible, strongly encourage virtual. And there are a number of people who think, well, I can't do, let's say, lawyers. I'm working with one legal firm, and there are a number of lawyers who are saying, well, how do I interact effectively with clients virtually? They can learn. It's easy. It's not easy to do that, but you can learn, and you can offer effective service delivery virtually if you learn how to do this. And there's definitely professional development in this area. I wasn't nearly as capable of doing virtual presentations as I became with COVID-19 around. So this was something that I spent quite a bit of time investing in professional development and virtual presentations, getting better certifications for doing virtual training, which I got from e-speakers for virtual certification, getting this program that you can see me and the slides at the same time, investing into that, and so on. Some will find it easier than others, and some will find harder, but you need to be creative. And I have to say, for some businesses, the best choice may be to close and liquidate. I mean, it's not easy to hear, right? Not an easy thing to hear, and it's not easy for me to say, but I had to encourage some clients in the restaurant industry that this is not an industry you want to be in, because the restaurants are not going to do well in the pandemic. restaurant, live entertainment is not going to do well in the pandemic. This will be much longer and much more difficult than they think it is. And so I had to strongly encourage them to sell to somebody who is more optimistic, or if you are not in the business owner, then leave that area. Relationships. This is actually an area of professional development that you as HR professionals are responsible for helping with. You want to train people. There's specific training in how to establish new relationships and cultivate existing ones with external stakeholders. This is part of the external business model. Again, clients, service providers, political leaders, a lot of money coming from them, prospects, investors, suppliers. This is a professional development area. How do you have effective virtual relationship building? Managing disruptions, another important area that you want to think about. External stakeholders of various sorts, like the ones I mentioned. You're watching this webinar, you're engaging in it, you're going to be much more savvy about what's going on, but they won't be, unfortunately, because they aren't here and they're not checking out this webinar. Most won't be prepared for the long-term disruptions, and you need to protect yourself against their failures. This is a matter of strategic planning. Shifting norms. You've got to remember that our norms will shift after several years of restrictions and loosenings. If we get vaccine widely available in the realistic scenario of 23 to 25, that's going to be especially bad. But even by 2022, it will be pretty bad. We'll have different norms, values, desires, habits, expectations, and you want to help your organization, your business get ahead of these. Look at the shifts, anticipate them, get ahead of these shifts, be where the market will be eventually. And that way you will position yourself really well for success. Think about unknown unknowns. So this is something that you have probably thought about, realized that the pandemic was a predictable disaster. Many people thought it's an unknown unknown. How could we know? It's a black swan. Well, it's not. People like Bill Gates and other prominent leaders have been predicting that we'll have a pandemic. We're not prepared for it. We're going to be in a pretty tough spot. It was a predictable disaster. So you want to be a risk management expert. So that's often part of HR function. Scan the environment for major predictable disasters and protect against them. Some things, of course, can be predicted. A solar flare, major solar flare that takes out everything from GPS to a lot of electric power. That can't be predicted, but that's something you can protect yourself with a cash cushion. And next, this is something that your leaders will love. Outcompete your competition. If you integrate the steps that I shared about the internal business model and the external business model, they'll love the fact that you'll help them gain a major competitive advantage. Many will fail to adapt to the pandemic. They'll stumble. And this is an opportunity to get ahead of them, seize market share, and hire away good employees. All right, time for another poll. So take a look at the next poll. How well has your organization transformed its organizational model to adapt to the pandemic? Please vote. See, most people voted. Give people 5 more seconds to vote. If you haven't voted yet, please vote. All right, so we have 2/3. So no one is doing great. No one is happy with where they are. 2/3 need some improvements. So it's great you're realizing you need improvements, and you can take information from this to do that. And 1/3 need serious work, so need a lot of work, need fundamental, basic organizational changes to adapt to the reality of the pandemic. So it's good that you realize this. And that's something you as a trusted advisor can bring to your leaders. Let's take a look at the last point that I want to talk about. How do you plan for the long-term impact of the pandemic? We already talked about adapting, transforming, but making a strategic plan. So this is something that's really going to be very helpful if you make an effective strategic plan. Think about the possible futures. 5 years out, look at problems, opportunities, resources you need, and information that will tell you which future you're heading toward. So you want to not simply think that there's going to be one future. You want to plan for a variety of them. A variety of futures, and invest your resources accordingly. The optimistic one, the moderate one, and the pessimistic one. So what we talked about before. Think about 5 years out. Where would your company, where would your organization be in each of these scenarios in 5 years? Each of these scenarios, the optimistic scenario, the moderate one, and the pessimistic one. Then think about problems. What kind of problems would be associated with each one? Think of ways of addressing these problems in advance. For example, if you are anticipating that you'll have a lot of employees who will be struggling with the situation that you're shifting back and forth between office work and at-home work, office work and at-home work, then you can address that effectively. I brought up a number of issues. Virtual communication is going to definitely be an issue that you can address in advance through professional development, resolving conflicts, employee engagement. So those are issues that you can address in advance. Or you can make a plan to address specific issues that might occur as they occur. So for example, if you have specific issues with your cybersecurity, you can address that as they occur if you have an effective plan, or PR issues, something like that. Then opportunities, not simply bad stuff, but good stuff. Think about opportunities that might occur in each of these scenarios. Each of these scenarios, what kind of opportunities might occur? Especially in the case that the pandemic will go on into 23, 24, I can guarantee to you that there is going to be a number of competitors who stumble. So I have my clients right now going to some prospects who are working with their competitors and saying, hey, Mrs. Prospect or Mr. Prospect, we have taken steps A through F to make ourselves pandemic proof. So this pandemic does go on longer than you anticipate and longer than my competitor anticipates. Please give me a call and I'll be happy to help you out if my competitor is not doing a good enough job because of the pandemic. And I can guarantee to you that they'll keep them in mind and give them a call. So this is something that you get yourself ahead of opportunities. And of course, you can make a plan to seize the opportunities if they occur. So for example, have some cash in reserve to hire away good employees from some stumbling competitors. Think about the resources you'll need. What resources will you need for each of these scenarios? Money, time, info, social capital, strategic planning, and so on. And I strongly encourage you to not plan for the optimistic one. Really reserve enough resources, ideally for the pessimistic scenario, but at least the moderate one. Don't plan for the optimistic one. And think about the information. What kind of information would tell you which scenario we're in, right? So if you are going to the end, if we're in the end of 2020 and you're not hearing that we're having great news with the Moderna vaccine, or we're having great news with Pfizer vaccine, with it being, in the early initial results show it's 90% effective. It doesn't matter whether it produces antibodies. What matters is how effective it is in actually preventing COVID-19 in the existing population. So if you're not hearing that, that clearly means we're not in the optimistic scenario. And don't accept hype from companies, by the way. This is something that you should be hearing from external objective observers, people like Anthony Fauci, or let's say Bill Gates, very prominent observer who's very invested. He's not getting zero profit from getting COVID-19 vaccines, and he's spending a lot of his money, his foundation's money on it, just as a philanthropist. So this is someone that you can follow on vaccines. And you want to adjust your plans accordingly to what's happening, and then execute, execute, execute. All right, last poll. Let's take a look at the last poll. How well suited is your current strategic plan to the long-term consequences of the pandemic? So we talked about how do you make an effective strategic plan, and I want to ask you about your current strategic plan. Please take a look and vote. See, most people voted right now. Maybe 5 more seconds for people to vote. All right, so you'll take a look at the results. So for 15% of you, it's very well adapted. Great, excellent. So I'm glad to hear that it's very well adapted. For the rest of you, you're tied. While just under 43% have some moderate tweaks needed. So good that you're realizing some moderate tweaks, and please take the time to do those moderate tweaks in the near term, because that's going to be important for the long-term consequences of the pandemic. But the 43% of you for whom serious revisions are required, that means that you really need to take the time to sit down, look at your strategic plan, look at revisions, really make a major strategic overhaul, like the oil and gas company is going to be doing with the strategic retreat that I'm talking about. So this is something that you really need to be focused on effectively. All right, so next, I'll just let you know that you can go to tinyurl.com/d-event, fill it out if you want some additional resources, free coaching session with me, and 2 chapters from my new book, which I mentioned before, Resilience, Adapt and Plan for the New Abnormal of the COVID-19 Coronavirus Pandemic. So again, tinyurl.com/d-event. All right, at this point, I'll be happy to take questions. So whatever questions you have, please shoot. You can type them in the chat if you want to, or we have a pretty small crowd. You can just also unmute yourself and ask the question verbally.
I have a quick question. So thinking about the 3 optimistic, pessimistic, and expected, the 3 options there, do you take into account not just the vaccine, but also the fact that, that there could also be some treatments developed to treat COVID-19 as well in that time frame?
Yes, I do take into account. And what we've seen is that so far the treatments that have been developed, and remember, we've been working on treatments ever since December, starting in China, which has a pretty good medical health system. And then we've been working in the US and elsewhere around. And so we've had around 8 to 9 months to develop treatments. So far, we only have 2 effective treatments. Remdesivir, which shortens hospital time, average hospital time from 15 days to 11 days. So that decreases, of course, morbidity, sickness, might slightly decrease mortality, but doesn't really address the worst cases. So it decreases hospital time. That's its main benefit, which is good, not that great. And we have a new steroid medication that, well, it's an old steroid medication. We just learned that it's effective for the worst cases of COVID-19 for people who are in ventilators. It decreases deaths by around 20%. And for people who are in the hospital, not on ventilators yet, it decreases deaths by about 10%. So given that those aren't very high numbers, let's just be honest, So given that we've been working on these things for that long, and that's the best thing that we've discovered so far, I am not at all optimistic that we'll find something really effective against COVID-19. I mean, we don't have anything effective for that category of viruses, for coronavirus. We just have palliative things and things like remdesivir, which slightly decrease the impact of the virus.
Okay, thank you.
You're very welcome. It's unfortunate, it's sad news, but yeah, I've looked at this stuff. So vaccine is really the only effective solution.
Okay, thank you.
Sure. Reba asks, what are you seeing long-term to solve for direct employee need for service delivery, housekeeping, dietary service in hospital settings? So the only things that I'm seeing, which people are doing proactively, is obviously CDC guidelines compliance. So that's good. Unfortunately, far from everyone is doing really good compliance, and that's pretty terrible. So that's legally actionable, perhaps, potentially, depending on the kind of laws that are passed in Congress with this new negotiation between Democrats and Republicans. And some other areas are what they're doing to address this is things like replacing housekeeping with automation and things that they can actually address people's health that way. So robots with UV lights or something like that. So there are some things being done with automation, but of course, that's only the most wealthy places that are able to address this sort of stuff. I mean, there's things like robots for service robots instead of having someone over to take care of the elderly. Those sorts of things are happening as well. And all right, other questions? Give people 10 more seconds for those who are shy or have a long question to type out. Okay. Well, thank you very much. I have appreciated you coming here, and I hope this has been helpful for you, even though it's not easy to hear. I hope you will gain something from the presentation and the information that you've heard. All right.
Thank you very much, Gleb. Appreciate it. Thoughtful presentation, thought-provoking, and appreciate your time and partnering with us. So thank you very much. Wish you well. Thank you everyone for joining us, and we'll see you next month. Thanks everyone.